All right, Dr. Liao. I'm really excited about the HealthCare 2.0 event. And it's a true mastermind of sorts, right? And I think that never really before in health have we really have a mastermind specifically surrounding collaboration and integration of artificial intelligence. And I think the reason why we're doing that is because the AI, the technologies have come so far, and plus it's going to change almost on a monthly basis, like moving forward. Literally 6 days ago, we just saw a release of a video of an AI looking at someone on their mouse, on their cursor, and then it's suggesting automations and processes to decrease the number of clicks, and the AI is going to do it for the person overnight. The dragging and dropping and stuff like that, right? So that's just like a small example of what the AI can do. More importantly, I think that the AI aspect of it can help create collaborations between healthcare professionals. I kind of want to ask you, like, why do you think it's really important, like, for the future of dentistry to involve collaborations of like pharmacists and physicians and stuff like
Yeah. So it's a brilliant question, and I've thought about this quite a bit. It's important to understand dentistry's past before we can talk about the future.
that? Okay.
Dentistry evolves out of putting out fires, infections, abscesses, swollen faces. It used to swell up the floor of the mouth that people get killed in the Wild West. Okay. Dental infection was a real problem when the sailors from Europe discovered sugar from the Far East and bring it back to Europe. And then it's been causing dental trouble ever since. Now, um, dentistry has succeeded brilliantly in prevention. Like generations ago, enter by 50 in great grandma's generation was common and even expected. Now, you don't expect your child to ever lose a tooth in her life, right? So, this is a drastic turnaround. And if only the war on cancer and high blood pressure could have as good a record. So, dentistry figured out something. And it has done a remarkable turnaround from putting out fire to preventing. And now we're going to go to the next step. Okay. So when I say preventing, saving teeth from being lost. Okay.
Mhm.
Cool. So now there is this small niche of dentists who have become so called biological or holistic dentists. Their concern is in the dental materials contribution, dental infections contribution to systemic health. And so I can give you an example. There's some biological medicine doctors who would just make sure that the patient who's got cancer would be free of dental infections and certain toxic materials before undergoing chemo treatment.
Mhm.
And they have seen much higher success that way. Okay.
Mhm.
So that's the systemic connection from the traditional dentistry. Now we're going into airway. Some of us dentists are becoming airway mouth doctors, and it's an important distinction where airway rules the whole body, and everything else is secondary to either breathing or gravity. And the dentist who turned mouth doctor actually has a very pivotal role in the patient's overall health, medically, dentally, and mental, emotionally.
Mhm.
So if you get a bad night's sleep, your mood is not going to be as good. That's why. But the premise for a good night's sleep is that you have an unobstructed airway.
Absolutely.
So the future of dentistry really comes down to this. There's a paper out in 2012 from Stanford University Sleep Center. It basically says that pediatric obstructive sleep apnea in non-obese children is a disorder of oral facial growth.
Mhm.
Right. That means that we got to grow the jaws in order to avoid sleep apnea and airway insufficiency. All right.
Mhm.
So now the question is, who is in charge of oral facial growth? We don't have a mouth department in any of the major hospital centers. We don't have a mouth department in any of the research institutions. All right. We have the elephant chopped up into different pieces.
Mhm.
And so your point about integration, about collaboration is really important on how to put every elephant back online from the bits that the research dives into. All right. And what I can say from my experience is that when you restore a structurally impaired mouth by growing it epigenetically, that means that regardless of age, if you have sound teeth and you follow a certain steps that pertains to epigenetics, we can regrow the jaw and we can regrow the airway. So I think that's where the future of dentistry is.
Yeah, and it does involve a lot of collaboration because a lot of people who are on this, let's say the kids with, or even adults with inattention, they could be on stimulants, right? Um,
Absolutely.
yeah, let's say there's a lot of people with pain, like fibromyalgia, right? Which is a huge oral contribution, and they're on these chronic pain medications, or maybe they're taking sedatives for sleep, and that can actually worsen some patients as well. I think this area of us just prescribing medications to overcome some sort of symptomology, we're in even in the holistic medicine fields and functional medicine, we're naming it different things, or naming it things like adrenal fatigue or thyroid disorders, et cetera, et cetera. But in reality, there's a huge oral airway contribution to the adrenals and to the thyroid.
Absolutely.
Yeah.
Yeah.
And I think that's the biggest missing piece in what we have, which is the involvement of the airway into the actual discussion. So I think using artificial intelligence to create a foundation of this is the desire for healthcare 2.0, is for us to look at applications. So let's say that like you have a patient who is seen by a physician and maybe they're on blood pressure medicine and they don't feel very good, right? They're on this like beta blockers and they're on calcium channel blockers. They don't feel very good. And then let's say that they have sleep apnea and then CPAP, but they can't really tolerate it, et cetera, et cetera. And then what happens is that they are taking other things for sleep. Maybe it involves some supplements, maybe it's all magnesium or CBD oil or something like that. And then that's doing okay, but it's not improving. And over time, what happens is that this person starts losing short-term memory and overall long-term memory. So we're seeing this conundrum of these metabolic disorders and insufficiencies and mitochondrial issues progress over time. Part of it is because of the underlying lack of attention really to the airway improvements. Another big part of it is polypharmacy. Huge part of it is
Yes.
the medications that they're on,
Yes.
the side effects actually create huge deterioration to the quality of life, right? And this is what
Absolutely.
pharmacists needs to get in here and see, hey, what is the drug interactions, drug supplement interactions, drug airway interactions, right? Which there always is. And that's been my struggle as a physician is I'm not trained to look at deep prescription and prescription models when it involves like physical contributions in collaboration with dentists and airway mouth doctors and other physicians as well as pharmacists. So I think what we've been using here at Texas Center for Lifestyle Medicine is that we've been using artificial intelligence to figure out how to bridge the gap, if you will, and how we can all really benefit ourselves and our practices, and also benefit the patients as well, but also make it become a really compelling business model. And so I was talking to one of my buddies, and I was looking at the website. He's a dentist, and his wife's a physician. I was looking at his website, and I was like, you know what? This website doesn't really describe what you do. It talks about smiles and teeth and stuff like that. But he's an airway mouth doctor. He's trained in like airway dentistry. And I'm like, there's so much value to you that's not really explained on your website. You have to
Absolutely.
really take someone like me who understands it from a physician's point of view and say, hey, you're actually solving a lot more problems here. And so even our AI engine actually knows that and say, this doesn't really match up, right? And then you get into operations. So we have another physician actually. He's a oral surgeon, and he's getting a little burnt out because there's so much like turnover, employee turnovers within the practice. And part of the reason is that the employees aren't necessarily fully educated in what they do as well, especially with airway. And so AI is able to pump out like educational resources for the employees based on their own speaking language and their own vernacular that's customized to them. So it's almost like you have a training manual specifically for this employee, right? Which can happen as well. And there's other models looking at retrieval augmentation. Basically, you're retrieving, let's say, sleep apnea, CPAP data, and you're saying that this person is on this appliance and either doing well or not doing well. So you actually can construct your own analytics within the practice really simply with artificial intelligence these days. And so what does it do? It elevates your value as a practitioner. It elevates the value proposition described to the public and to the patients. Increases the number of referrals. It keeps the employees working for you because they have a much better understanding of what's really going on. And most importantly, it decreases burnout. And I think this is the reason why we have Healthcare 2.0 is we want the clinicians to be at the center of where medicine is going, not the pharmacists, or not, sorry, not the PBMs, the organizations that control prices for medications. Definitely in the hands of the practitioners we want to divert this to. The actual pharmacist, the actual physician, the actual dentist, the actual physical therapist, right? And so I think that this is the whole concept of Healthcare 2.0 because really recently, this past week, we just had the 2024 health conference in California. And there's AI in everything. And the big corporations are actually using AI to knock us out because they're trying to bypass clinicians at this point. And so
Yeah.
none of us are safe, especially in the pharmacy world. That's a huge deal. But none of us are safe from it. So we have to be on the grounds and providing our own ecosystem and structure in order to really combat this, right? And I think we have to really save the future of healthcare with healthcare 2.0. It's no longer an option, right? This is a necessity for us to have in the field of practice.
If I may, I liken the healthcare 2.0 to the Continental Congress before the American Revolution. This is a blueprint
Yeah, yeah.
for a new world of healthcare. Okay. It's going to be physiology based, not drug and profit based.
The physiology-based healthcare has traditionally been in the holistic or integrated field, but the reality is what's also coming up is that because we have so much data analytics with AI, we're already seeing improved outcomes with like lifestyle medicine and preventative medicine, right?
Yeah.
Well, I think the values there is, especially in the post-pandemic era, the values are already there, and we're driving value towards that. It really requires a top or sorry, a bottom up approach, foundational approach into what we can do to address this. We have our 3-day mastermind event coming up, followed by an entire year. We'll be doing monthly Zoom discussions with incorporation as well as innovation. Over 3 days, Dr. Liao, you're going to talk about airway spatial epigenetics, right? Um,
Yes. That means we can regrow that regardless of your age.
okay. So regrow the airway, and the concept here is that the airway is the driving factor for mental health and metabolic health. And
Yes.
epigenetics is gene expression based on what's called the exposome, what you're exposed to during regular life, right?
Right.
Um,
So, two things: oral behavior and oral environment. Change that, and airway will change.
you gotcha. And the other part I will be talking about is actually constructing your own AI assistants and your own AI engines for your practice.
I can't wait. I
This is
have
super
lots of
important.
data that I can't wait for it to be pulled out.
If you have a lot of data, or if you actually
I do.
every practitioner has data because you have an EMR. So if you have data and you guys to see how people improve, and then you start utilizing scribing data where the AI can actually scribe your conversation with your patients, and then you can get data of whether someone improves or not. And then you put it into the AI engine and you can have percentage improvements. It's almost like data on tap. And I encourage every healthcare professional to publish their own data anywhere. Literally, it could be on your website if you want to, because when
And I would encourage every airway dentist, every general dentist, holistic dentist, go and attend this Healthcare 2.0 to learn the AI part
oh yeah,
so that you can see what you're doing as being effective and therefore worth sharing.
yeah, and even and most people think AI is adding on to the field of dentistry or medicine or pharmacy. It's not. It's actually should be the foundation. So if you have artificial intelligence at the foundation, this is what it looks like. So let's say you have a patient like coming into your office. The first contact they have with you is on the internet. It could be Google review, it could be a Facebook review, right? And then they go to your website. And then they have to like your website first, right? And then after that, they have to show up. And then when they show up, they have to be given the directions, treatments, plans. The administrators have to make sure, if they take insurance, they have to make sure that insurance is correct. You do your cash practice, you have to, your administrators have to make sure that there's value in the things that you're doing with cash. So all these things so far, when you put on the foundation of AI, is a lot easier to do. And then staff training and staff turnover is the biggest headache ever, right? And so even with staff training, you get the AI to understand the personalities of your staff, what they're like, and create engagement formulas. What that really means is how people speak to each other in collaboration. And then you can audit when something goes wrong. That's what I do. Sometimes I have conversations that's recorded on Microsoft, and we audit, hey, the AI knows that this person, this type of personality, this person is this other type of personality. It's auditing conversation of where you go wrong. So understanding the gap of where this person is and why there's a resentment that's created. And if this person wanted to quit, like why is that there as well? And most of the time it's a big communication and misunderstanding, right?
Yes.
Yeah, and you're able to
Yes.
do that with the patients too. Like, why didn't the patients come back for their follow-up? Like, you can actually audit that with artificial intelligence. That's huge. Right.
Big. Yes.
Yeah, and then you can actually
Yes.
create.
You never know. You never know when a patient's trauma button is, and you
Yeah,
unintentionally they trip on that button, and boom, they're gone,
yeah,
and they're mad at you.
same thing in
Or
yeah, same thing in the physician world, the identical, right?
yeah.
So now you can even get what's called sentiment score, so you can actually score, performance for your staff based on how the patients are actually receiving the information as well. So all this is actually available at the fingertips. We're not talking about some big $100,000 system. No, we're talking about even with general like ChatGPT and we use Perplexity and Microsoft and even Google Gemini. You're able to actually do this like really easily, and that's what the AI construction of the labs for, is build a foundation on the AI. And the last part is this: is that we all have some sort of plan for our lives later. We don't know what's going to happen, and everyone should have an exit strategy, right?
Yes. Yes.
Value of your practice actually depends on the proprietary intellectual property that's within the practice. And whenever you're building AI systems, right? It's like Lego blocks. That is the actual intellectual property that can go with practice. Let's say if you want to sell the practice and et cetera, et cetera. Because at the end of the day, the IP, the intellectual property, may even be more work than the actual practice itself. And so we're talking about these strategies for, because so many healthcare professionals build a practice. At the end of the day, guess what happens? They're the operator of the practice. And because they want to retire or do something else, they stop and the practice value is just very minuscule. But then if you
Correct.
build intellectual property within your practice, especially by building the AI as a foundation into the practice, that brings up a whole new realm
Correct.
of,
Correct.
right?
Correct. In
Yeah.
the old days, I can only speak in dentistry terms. The worth of practice is assessed on the number of patients coming back for hygiene checkups. Now, going to the future with data gathering and analytics, it could be based on the positive difference an airway mouth doctor can make.
Yeah.
Yeah.
And additionally, if a lot of practitioners are trying to get new associates on board, right? There's training involved as well. But the AI can actually look at your notes and understand the patterns of what you accomplish and make training for the new associates that are coming in as well. That's really
Sweet.
right.
Sweet. Yeah.
Someone
Yeah.
like you, that's
Yeah.
really important. And so we'll be literally having our laptops open to understand how to construct this. You can literally construct AI departments and AI assistants within certain programs that are talking about dollars a month. We're not talking about anything crazy, right? And then you're able to understand that data. And then it's a secure data. It's not public data. It's not trained on public data. And then you can turn these things into action items and even financials, like financial analytics with AI is superb. It is absolutely superb. If you have financials, bank statements, CSV files, whatever it is, and you put an AI onto that sucker, it's going to turn those numbers into words. So the things that you want to do as well. Because I see so many doctors just struggle unnecessarily because doctors, or there's no math in medical school. If there is, it's not for financials, right? But
Right.
there's specific terms whenever we're building a business that people don't understand, but there's ways to actually construct the AI can actually have your back when it comes to financials, when it comes to value of the practice. Like that's huge, right?
Yes.
And so not only are we building great medicine, we're building a great medicine with a business model that's there. And a lot of the AI can overcome the deficiencies of a lack of knowledge whenever it comes to the actual business building part, right?
Yeah.
And so
So healthcare 2.0 is not just about learning another technique or another philosophical platform. It's also about revolutionizing your financial future.
I
Yeah.
should put it on the website actually. Think about it. So the the AI revolution is going to help patients. It's going to help the clinicians, it's going to help physicians, dentists, pharmacists, physical therapists, workers. What it doesn't help is driving pharmaceutical sales because we'll be using deep prescription protocols that we can actually construct live. The other really cool part about Healthcare 2.0 that people are not going to be used to this because they've never seen it is the AI is actually part of the participants, but the AI is also always learning and listening. Is able to understand what each person wants. And so everyone's really going to have a voice when you're at Healthcare 2.0. It's not a person on stage talking to you and talking at you. It's a conversation. Healthcare 2.0 is a conversation, right? And so we want to get the people who have the most passion within the field, understand what drives the passion, but also get everyone's experiences of what not to do. And we can make an AI knowledge base what not to do or what people have experienced in the past, and we keep that ongoing for a year. We're talking about the biggest operational strategy AI for all of healthcare here, right? But it's constructed by the people who are delivering the care. Look,
So if you ever feel lonely in your practice,
yeah.
join our tribe because
Mhm.
this is going to be a tribe of people who are just like you,
Yeah.
looking for connections, looking for meaning, looking for purpose, looking for something grander. All right. Do you remember what you went to medical school or dental school for? That got lost somewhere along the way, and here's your chance to get it back.
It sure is.
Gets we excited again.
Yeah, it's also for prevention. The way that we do medicine is just changed dramatically in the next year. Seeing what they release at Silicon Valley is scary. Most of it is to bypass actual human work. Most of it is to drive sales or usually something else. It's not.
Not surprising at
Not
all.
forever,
Yeah.
right?
Yeah.
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 But I think the first time in history, and I'm not a computer programmer or anything like that, but the first time in history, like we're able to utilize these tools with a basic foundational knowledge of it, and that can be taught literally in minutes, and then put into action and actually see what happens. That's what we really want to bring, and that's the whole purpose of the healthcare 2.0 is putting it into action. Right. It's when me and you last recorded a video, or it was talking about facial epigenetics. It was talking about the skull structures and the airway. And it was about a year and a half ago. Oh no, almost 2 years ago. Almost 2 years ago, we did our first video. And then we did another follow-up video and I looked at the mental health, the dentist role in mental health. I think is the name of that video. And fast forward to now, not that much time has passed, but a lot has changed in the actual environment, the way we practice medicine. It was to a degree that I couldn't have imagined. And I think that for people who are going to be at Health 2.0, you're going to get to see the underside of what really happens when we just let healthcare do its own thing with other powers that are at work. It hasn't been pretty. It's not going to be pretty.
It's going to get uglier too. It's going to get uglier.
Yeah, significantly.
Yeah.
And
Because greed knows no bounds. It's the one thing you can count on.
greed knows no bounds. That's true. So whenever we're constructing this 2.0, and the tagline is this, right? It's about AI and tech, yes, but it's not all about heart-centered entrepreneurship as well.
Yes,
But
yes.
put our mask on ourselves before someone else. From not a CPAP mask, but just on the airplane mask. Well, but the idea
Right.
here is that we're all
Heal the healer.
Yeah.
Heal the healer first.
we got to do that.
Yeah.
And then healing the healer, we get to gain insights. We
Yeah.
get to gain insights into things and really build a purposeful life.
Yep.
A purple
Yeah.
for life involves being in a tribe because we know that loneliness is the number one cause of death. And being part of our organization can increase our lifespans. But being part of a collaborative care organization and also mutual respect between the physicians, the dentists, the pharmacists, and all the healthcare professionals, that's huge. And that's not something I take lightly, right?
So I want all the pharmacists who are capable of helping with descripting their dentists and their patients looking for you. For all the MDs out there struggling with patients who are CPAP intolerant, there's airway mouth doctors who can provide epigenetic solution that's one, painless. Two, it requires no shots, no drills, no surgery, no screws, no wires, and no braces.
Uh-huh.
All right. This is about gene expression. What does it take to grow? Just watch your daughter grow, right?
What? Exactly.
Care and feeding, right? And breathing and sleeping. It's that simple. Just change what it has been.
Yeah. Yeah. What's great about this is it's 3 days, and you'll have access to myself and Felix and other people. But it's not functioning as a conference; it's functioning as a mastermind. And so everyone's voices will be heard. And you're not want to talk and sit in the back, then don't come. To be honest, that's not what this is. This is more like more existing like a round table than it is a speaking at you conference. And
Right.
what we want is we want everyone to contribute to the conversation so we understand and we know what everyone really wants to desire coming into the 2025 and what healthcare 2.0 looks like in 2025 and beyond.
So if you have those of you listening out there, if you have something to contribute in the way of interdisciplinary collaboration, show up and speak up.
Yeah. Yeah. So, but I want to ask you, Felix, it's been really tough for you in getting this idea out there of airway epigenetics, get the idea out there that the airway is really the key to the health. And what were some of the struggles as you're like even coming out and talking about this and writing your books, if any?
Mostly, so from the consumer standpoint, it's very different from practitioner standpoint.
Mhm.
Patients say, God, where have you been? I've been looking for this answer all my life. Okay. So patients cannot wait. Now, on the dentist standpoint, there are people who are comfortable doing the drill and fill, and I have nothing against that. I was once a card carrying member of various outstanding dental organizations. I'm a board certified general dentist, believe it or not. There is such a thing. Okay. But dentistry's future is not in drill and fill. It's not even in implants. Where we should stop being appliance or drug pushers. We should not be in pushing procedures. We should be in restoring patients' own health. We should be facilitators instead. All right. Some dentists can't wait to embrace this and acquire a new skill set and get rid of their drill and fill and surgical sets. Okay. And physicians probably have the biggest challenge. Physicians are already inundated with so much responsibility, having to bring on so many answers that are so-called evidence-based. My challenge has been basically getting to the 100th monkey.
The
We now
hurry
have
monkey?
about eight. Yeah, yeah. We now have about 40. Okay. We just need a second. No, it's a question of time because the physiology is there. Just as sure as gravity points downward, the only way you're going to heal and you're going to have effective healthcare is physiology is honored and genes are accessed.
Mm.
Yeah, your own genes, not genetically modified genes, okay? Your own natural genes that you inherit from both parents. We now know how to bring on your daughter's best face based on the genes that she inherits from both parents. Yeah,
Yeah, yeah.
that's big
And
because now you will have airway almost guaranteed, provided that the behavior is there.
yeah, and from my standpoint, getting this information out there is surprising for me because I'm trained traditionally, I'm also trained functional medicine and integrative health. And whenever I get this to my integrative health practitioners, there's a surprise. want to
Yes.
relate like
Yeah.
fibromyalgia, chronic pain to like the teeth,
Mouth. Right.
airway.
Yeah.
There's a surprise there, right? Like
Yeah. Yeah.
peripheral neuropathy and airway. There's a surprise there. Parkinson's, Alzheimer's. There's a surprise there, right? And when I talk about terms that are used in holistic medicine, like the adrenal fatigue, which basically is a undiagnosed sleep disorder for the most part, and when I look at other things that are relating to the ineffective sleep and airway restrictions, we start realizing that most chronic diseases are this. But more importantly, over the last few years, when they get treated, the medications can come down, the blood pressure starts normalizing. All of a sudden,
Yes.
there are these vibrant people whenever their airways are actually treated. Now, that's not true for 100%, but we're getting there. We're getting there. And I would say this, I would say that the medical community has not seen any sort of collaboration behind this yet. And that's what healthcare 2.0 is.
Yes.
But if a patient can go to a dentist and then let's say get appliances or even orthodontics done by the orthodontist who's trained in airway, then all of a sudden their blood pressure medicines may be too much for them. It's actually taking their blood pressure, right? Their beta blockers maybe slow the heart rate too much because they're start normal.
That's right.
Their pain medicine, that's a big one, maybe too much for them. The ADHD medicine all of a sudden make them too jittery. So they're like, the problem with that is that a lot of people assume that these are side effects from the actual procedure or the appliance, but in reality, their medication is too much for them. And we see that all the time. And this is my message for the dentists and airway mouth doctors out there, right? And for the pharmacists, is that a lot of times we blame so much of the side effects on the actual procedure or the appliance. We forget that the body naturally balances and the medications that you're on is too much for you. That is,
Excellent.
pharmacists have to know that. The MDs have to know that. The dentists have to know that. We have to have a singular like response to that. And there's no standard operating procedures that have been done, but we're constructing it now, HealthCare 2.0.
And so if I may add,
Yeah.
one takeaway is that medical patients have dental problems that don't get addressed by the physician side. Dental patients have medical symptoms that don't get addressed by the dentist from their own offices. Okay.
Yeah.
But I can tell you that the mouth contribute to up to 80 to 90% of all of those symptoms. All right. In other words, you've addressed the mouth and there is a need to taper back whatever medication the patient is on, whatever diet they're on. There needs to be a recorrection once all of those treatments that are implemented because this part was missing. Now that it's come online, I need to be readjusted.
Yeah.
Yeah.
Now it's
Yeah.
coming back online. There's a rest.
Yes. Yes. Yes.
And listen, if it happens to one family member, it's probably happening to other family members as well. Facial.
And generation to generation, they eat the same Sunday evening dinner. Yeah.
And the other reality is that it's probably happening to us, the healthcare professionals ourselves as well. It's a pretty common thing, right? Especially in the generations moving forward. So we have to be the proof that the product works. Means that
Yes.
we have
Yes.
to be the proof that we're able to improve our own health and vitality by looking at the mouth and the airway. Learn that from this, and then put it into work and put it into systems, right?
You bet.
Like the American College of Lifestyle Medicine, Institute of Functional Medicine, A4M, there's a lot of great organizations that are out there. There's a focus on food and diet, nutrition, lifestyle, period. There's a focus on integrative strategies and mental health, right? There's a focus on everything else, but really the airway and how it relates to everything else. The focus just on food being the link to everything in chronic disease is great. There's nothing wrong there. But we have to look at the way that we're breathing because we're stuck constantly having our breath stolen away from us. Constantly, right?
Yeah. So food as medicine had been missing and now it's back in place.
Yeah.
So what's the next thing is that oxygen is a cofactor in Krebs cycle. And if you don't have oxygen, you don't have Krebs cycle and no energy. And energy is the difference between life and death, and illness and wellness. That's it.
Yeah. Oh, absolutely.
That's it. Yeah.
And we can't be siloed within our own organizations, within our
No.
own professions to solve this problem at all. Just doesn't, it's gotta.
In Intersection is what it matters now.
Yeah. But with AI, it's actually a lot easier to do.
Yeah.
Tons easier
Yeah.
to do.
You need to be an expert in your own lane. That's what patients expect, but you also need to know as an expert what else this patient in front of you is going to need besides
Yeah.
your expertise.
Absolutely.
Yeah.
Awesome, Felix. Thanks for chatting with me on this. We'll be partitioning parts of this onto the website. If you're actually looking on the website right now, I encourage you to join us at HealthCare 2.0. Once again, it is a 3-day event that leads to a 1-year mastermind where we're going to be incorporating technologies that are new into the changes in the field of medicine. I'll see you there. Thanks, everyone.
See you. Thanks, Cheng, for putting all this together.
Yeah, thank you.